An ingrown toenail, medically called onychocryptosis, happens when the side or tip of a toenail grows into the skin surrounding it. This can cause pain, redness, and swelling, most often on the big toe. Think of the nail as a small fence. When it bends inward, it traps the skin like a nail in a board game where the piece gets stuck. Cutting toenails too short or rounding the corners, the nail edge then pushes into skin. Wearing tight shoes or high heels that press the toe forward. Injury to the nail, such as stubbing or dropping something on it. Naturally curved or thick nails that already sit close to the skin. Repeating the same nail cutting habit over weeks or months. Typical signs you may notice are a sharp, throbbing pain at the nail edge, especially when you press on it or wear socks. Redness and a small bump where the nail meets the skin. Swelling that may make the toe look puffy. Sometimes a little pus or fluid if the skin gets infected, which feels warm to the touch. You can test it by gently tugging a cotton swab under the nail. If it catches the skin, an ingrown nail is likely. Doctors usually diagnose an ingrown nail by simply looking at the toe and asking about pain and shoe wear. No X-ray is needed unless a bone problem is suspected. Treatment steps include soaking the foot in warm, salty water 3 to 4 times a day to soften the skin, placing a small piece of cotton or dental floss under the nail edge after each soak to lift it away from the skin. If infection is present, a short course of oral antibiotics may be prescribed. For stubborn cases, a podiatrist can gently trim or partially remove the nail edge, partial nail avulsion, and may apply a chemical that stops that part of the nail from growing back. In severe or repeated cases, a small piece of the nail matrix is destroyed, matrixectomy, using a heated probe or a tiny amount of phenol, preventing that part of the nail from regrowing. You can keep ingrown nails away by 1. Cutting nails straight across, leaving a tiny white tip about 2 millimeters and avoiding rounded corners. 2. Filing the outer edges gently if they feel sharp. 3. Wearing shoes with enough toe room. Avoid tight socks or high heels for long periods. 4. Keeping feet clean and dry. After a shower, dry between the toes thoroughly. 5. If you notice a nail starting to curl into the skin, start daily warm water soaks right away. 6. For people with thick or curved nails, ask a podiatrist about regular trimming or a thin protective guard you can glue onto the nail edge. New research over the past few years has focused on making treatment quicker and less painful. Laser therapy, for example, 1,640 nanometers ND YAG laser, can precisely remove the nail matrix without chemicals, giving faster healing and less scarring. Cryotherapy, using a tiny burst of liquid nitrogen on the nail matrix, is being trialed as a non-chemical alternative. Biodegradable splints made of silicone that gently pull the nail away from the skin have shown good results in small studies, allowing patients to manage the problem at home. A recent review highlighted that early intervention with daily soaks and cotton insertion reduces the need for surgery by up to 40%.